Hello, I'm Kate Sullivan, an assistant professor at New York University's Silver School of Social Work. Along with my colleagues, Dr. Stacy Hawkins, Tamika Gilreath, Castro, I wanted to tell you about our new paper, which is now published in the journal Family Process and is titled Mental Health Outcomes Associated with Risk and Resilience Among Military-Connected Youth. In the context of ongoing international conflicts, there's a growing body of empirical evidence that suggests experiences related to wartime military service may be associated with increased risk of adverse health and mental health outcomes among military-connected youth. However, much of the prior work on this topic has focused on the effects of one stressor at a time, most often the deployment of a parent, rather than considering the potential impact of multiple risk exposure. Further, studies often fail to account for the many strengths of military families, including the wide array of informal and formal supports available to them. Using a person-centered approach and guided by a family resilience framework, the present study addresses these gaps in the literature by exploring patterns of concurrent risk and protective factors in U.S. Army families and their association with mental health diagnoses among military-connected children. To do this, we used big data methods to link several existing data sets. Protective factors, which included marital functioning, family cohesion, social connections, and social support, were drawn from a voluntary survey completed by 1,630 U.S. Army spouses. Risk factors, which included things like parent mental health, cumulative deployment experiences, recent family moves, and recent reunifications following a deployment, were drawn from the Department of Defense's archival data. Rates of mental health diagnoses among youth, which was an outcome in this study, were derived from Department of Defense healthcare records. We used the three-step method of latent profile analysis to develop family profiles and to associate these profiles with the risk of poor mental health outcomes among children. Several notable findings emerged from our analyses. First, we identified 5 distinct profiles suggesting significant heterogeneity across families with regard to their exposure to risk and their access to protective factors. Second, by far the largest group at 40% of the sample consisted of families with few risk factors and significant protective factors. Third, the rates of mental health diagnoses among children in the families in our sample differed significantly across profiles. The highest rates of mental health diagnoses at 30 and 31% were observed in the 2 profiles with the fewest protective factors on average. These findings suggest that most military families are faring relatively well, despite some risk exposure related to wartime military life. Rather than universal prevention programs, these results highlight the importance of targeting prevention and intervention efforts towards families with greater risk exposure, and particularly towards families with less access to protective resources. Clinically, these findings also emphasize the importance of assessing for both risk and protective factors, and they highlight the viability of family-level assessment and intervention. Traditionally, the military has focused minimal resources on families relative to the extensive resources devoted to the well-being and mission readiness of service members. Findings like those presented here suggest that increased attention to the well-being of military families may have relevance for both service members and their dependents. Thank you so much for listening to this brief description of our paper. I need to let you know that this work was conducted in coordination with the U.S. Army Research Facilitation Laboratory and was funded by the Army Resiliency Directorate. The U.S. Department of Defense does not exercise any editorial, security, or other control over the information in this article. The authors, like me, assume responsibility for the veracity, accuracy, and source documentation of the material, including no use of classified material and conformity to copyright and usage permissions. The views expressed in this abstract and in the full article are those of the authors alone and do not necessarily represent the official policy of the Department of the Army, Department of Defense, or the U.S. government. We encourage you to read the full paper and to reach out to us with any questions you may have. Thank you so much again for listening.